throat assessment. This is my mom. She will be the patient today. We're going to start off by assessing her head, noting the nasolabial folds and the palpebral fissures. Next, we will palpate the temporal artery, followed by her temporal mandibular joint. Open and close your mouth. Very good. Okay, then can you puff your cheeks out? Okay, very good. Clench your teeth. Close your eyes real tight. Wrinkle your forehead. Very good. Can you open your mouth, stick your tongue out? And then we're going to look inside and note the posterior pharynx looks good. Next part of the assessment is your ears. For this, we will grab the otoscope and we will pull gently down on the earlobe and check the tympanic membrane. Looks good. So we're going to switch out the light and check her nose now. We're going to note the nasolabial folds. Nasolabial folds, no, that's the midline. Nasal midline, the septum.
And you're putting your head in front of my face, and so you're covering my nose.
Nasal septum. And little nasal fold, palpate. Now we're gonna just check we're gonna go move on. Okay, now I'm just gonna ask you to do some motions. Repeat after me. Puff your cheeks. Smile. Clench your teeth. Wrinkle your forehead. Close your eyes real tight. Okay. Then I'm gonna have this in my hand so that I can use it. I don't have to wait. Then I'll ask her to open her mouth, and we're gonna note the posterior pharynx looks good. Okay, good. Then we're gonna check her lymph nodes. I didn't check the lymph nodes. Lymph nodes. Then ears. Then nose. Then eyes. Then eyes. Then throat. Okay. Take 6. Hello, my name is Alex, and I'm a CRNA student, and today we're going to be doing a head, ears, eyes, nose, and throat assessment. This is my mom. We will be assessing her today. First, we're going to start with her head. We're going to note the nasolabial folds and the palpebral fissures look good. Next, we're going to palpate the temporal artery and the temporal mandibular joint. Can you open and close your mouth for me? Very good. Next, I'm going to do some actions, and I'm just going to repeat after me. Puff your cheeks, clench your teeth. Okay, close your eyes real tight. Smile, wrinkle your forehead. Okay, now open your mouth. We're going to note the posterior pharynx and that it looks good. Next, we're going to check the lymph nodes. All right, we're going to check the pre-auricular lymph node, post-auricular, the occipital is behind, the tonsillar, submandibular, submental, the pre-cervical, post-cervical, and you can lift your shoulders, the supraclavicular. Next, we're going to check her ears. For this portion, I will grab my otoscope. I will pull gently down the earlobe and look to note the tympanic membrane. Okay, we're looking at the tympanic membrane, and it looks good. Next, we're going to assess the nose. We're going to look inside. We're going to note the nasal septum is midline and the turbinates are on the lateral wall of the nose. Next, we're going to grab the ophthalmoscope and check her eyes. First, we're going to check her right eye, and we're going to note the optic disc, macula are sharp and well defined, and the veins pulsate. Now we're going to check her direct and consensual pupillary response. So just look straight ahead for me. Very good. Very good. One more time. Very good. Okay, so we're done with the ophthalmoscope. Next, we're going to check some cardinal movements and confrontation. So just follow my finger without moving your head. Very good. Side to side. Diagonal. Very good. Just let me know without moving your head when you can see my fingers.
No. 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 No.
Okay, very good. So that concludes the eyes. Next, we're going to assess her neck. For this portion, to properly palpate, I'll have to stand behind you. Is that okay?
Yes.
Yes? Okay. So first, we're going to note the cricothyroid ligament, followed by the Adam's apple and the cricoid cartilage below, followed by the thyroid. Can you do me a favor and swallow for me? Very good. And right below that is the trachea. Everything looks good.